Have you ever thought about, like, turning back time, but without going under the knife?
Yeah.
Well, that's what we're talking about today. We're doing a
Yeah.
deep dive into aesthetic medicine.
Okay.
So aesthetic medicine, it's this really interesting field.
Yeah.
It kind of blends cutting-edge techniques with, like, this age-old desire to look good,
Yeah.
to feel beautiful. And we've got some really amazing material for this deep dive.
Okay.
We're looking at excerpts from a presentation all about aesthetic medicine, the past, the present, and the future.
Great.
I'm really excited to jump in.
Me too.
But before we do, huge thanks to London Heartbeat Z Academy
Yeah.
for their support in making this deep dive possible.
Mhm.
They're an incredible resource for anything related to healthcare. They've got over 140 courses,
Wow.
just a ton of information.
Yeah.
So make sure to follow them on Facebook, Instagram, Spotify, and YouTube.
Okay.
And yeah, don't miss any of their future updates or amazing discussions just like this one. Okay, so let's jump right in. What exactly are we talking about when we say aesthetic medicine?
Well, it can be a little confusing, right? Like,
Yeah.
what even is it?
Exactly.
So basically, it's all about achieving those results you'd usually get from plastic surgery,
Okay.
but without actually going under the knife.
Ah, I see.
You know, no incisions,
Yeah.
no long recovery times.
No scars.
Exactly. And fewer risks, too.
Gotcha.
We're talking about things like non-surgical facelift,
Oh.
using minimally invasive techniques. Some people call it soft surgery
Like soft stairs.
or petite surgery.
Interesting.
It's all about being gentler,
Yeah.
less invasive.
So it's like a gentler approach to
Yeah.
reaching aesthetic goals.
Exactly.
So, okay, I'm intrigued, but I got to ask, isn't this all just vanity?
Okay, that's where it gets really interesting, right?
Yeah.
Because it's not just about looking good.
Mm-hmm.
I mean, think about Maslow's hierarchy of needs.
Oh, yeah, that pyramid.
Yeah.
Yeah.
So, like, we start with basic survival.
Yeah. Food, water, shelter.
Exactly. But then we move up,
Okay.
and humans crave things like esteem, self-actualization.
Yeah.
So feeling good about yourself,
Yeah.
feeling confident about how you look, can actually play a big role in fulfilling those higher needs.
That's a good point.
Right.
It's not just about looking good.
Nope.
It's about feeling good, too.
Exactly.
Okay, so how does this all work?
So it's not like you just decide you want a treatment and you get it.
Right.
There's a whole process involved in aesthetic medicine.
Okay.
And it all starts with a thorough assessment,
Okay.
both subjective and objective.
Subjective and objective, so like from both sides.
Yeah. So subjective is like, what does the patient want?
Mm-hmm.
What are their concerns?
Yeah.
What's their medical history?
Gotcha.
And what are they really expecting from this?
Oh, I see.
And then objective, that's like, what do we see?
Okay.
What are the physical signs?
Mm-hmm.
Kind of got to put it all together.
So it's like a puzzle almost. Okay, so you're not just jumping into procedures then.
No, no.
There's like a whole evaluation process.
Right. So based on that assessment, we then develop a treatment plan.
Okay.
And this could involve a whole bunch of different techniques.
Okay.
Like using botulinum toxin,
Okay.
fillers, threads, even fat reduction methods.
Oh, wow.
And-
This is way more diverse than I thought.
Yeah, it's a whole world.
It is.
There's so much to it.
Okay, so before we get into the specifics of each technique,
Mm-hmm.
I'm just curious, like, what happens if someone wants these procedures,
Yeah.
but it's stemming from something deeper,
Ah, good question.
like body dysmorphic disorder?
Yeah, that's really important.
Okay.
Because as practitioners,
Mm-hmm.
we need to be aware of those underlying psychological factors.
That makes sense.
If there are any signs of BDD,
Okay.
then we need to refer the patient for a psychiatric evaluation.
Yeah.
It's essential because it's not just about aesthetics.
Right.
It's about their overall well-being.
Exactly. Their mental health as well.
Exactly. So we
Right.
got to make sure everyone's on the same page.
Okay, that makes a lot of sense.
Right.
It's responsible.
Yeah,
And it highlights, like, the ethical considerations involved in this field.
definitely.
And it kind of brings up another question for me.
Okay.
What even is beauty?
Ooh, that's a good one.
Right. Like, it's so subjective.
Totally.
Like, what one person finds beautiful,
Yeah,
another person might not.
totally different, right?
Yeah, so how do we even define it?
Well, you've hit on a fascinating point.
Okay.
There's this whole field called neuroaesthetics.
Neuroaesthetics.
Yeah. It's dedicated to understanding how our brains perceive beauty.
Interesting.
And it turns out it's super complex.
Okay.
It's not just one thing.
So it's not just like, oh, I see that and I think it's beautiful.
Nope. It's way more than that.
Okay.
It involves external stimuli,
Okay.
how our senses perceive those stimuli, emotions, and even cognitive processing.
So our brain is like putting it all together.
It's a whole symphony going on in there.
Wow. So our brains are orchestrating a whole symphony
Right.
when we perceive something as beautiful.
Pretty much.
That's amazing.
And aesthetic medicine plays into that.
Okay. I'm interested to hear how.
Let's delve into some of the specific tools.
Okay.
One that has a really interesting history is botulinum toxin.
Botulinum toxin.
Yeah, most people know it as Botox.
Oh, okay.
But did you know that it was first discovered as a sausage poison?
The sausage poison.
Yeah, back in the 18th century.
Really?
Crazy, right?
It's come a long way.
It has. And it wasn't actually crystallized until 1946.
So that's when they were really able to understand it?
Yeah, and like figure out its potential.
So from sausage poison to medical marvel.
That's quite a journey.
It really is.
And its medical applications started popping up in the late 20th century.
Okay.
So in 1989, it was used to treat strabismus.
Strabismus? What's that?
Crossed eyes.
Oh, wow.
And then in 92 and 2002, it got FDA approval for treating glabular lines.
Glabular lines. Remind me what those are.
You know those lines between your eyebrows?
Oh, the frown lines.
Yes. Exactly the 11s.
Okay, gotcha.
And then its use just kept expanding.
Okay.
Got approval for cervical dystonia in 2000.
Cervical dystonia.
It's a neurological disorder. Affects the neck muscles.
Gotcha.
And then hyperhidrosis in 2004.
Hyperhidrosis?
That's excessive sweating.
Oh.
And then even chronic migraines in 2010.
Wow. It's amazing how something considered a poison can become such a versatile tool.
It really is.
In medicine.
It's remarkable.
And you said it has aesthetic applications as well.
Oh, absolutely.
Wow.
So today, it's widely used to smooth out wrinkles, of course, but also to contour the face and body.
Okay.
And even to reduce pain after certain surgeries.
Really? Like which ones?
Like breast reconstruction, for example.
That's incredible.
It's pretty amazing what it can do.
It is.
And there are tons of commercial brands out there now.
Oh, wow.
So you can see how widely it's used and accepted.
Yeah, that's really interesting.
It's come a long way from that sausage poison.
It really has.
It has.
Okay, but I imagine there are some challenges as well.
Oh, of course. Nothing's perfect.
Yeah.
So one challenge is that there's no antagonist for it.
Antagonist.
Yeah, like there's no readily available substance to reverse its effects if we need to.
Oh, I see.
Another concern is tolerance.
Okay.
Meaning if you use it repeatedly, it can become less effective.
Oh, that makes sense.
And then there's also the chance of antibody development.
Antibodies, okay.
Which can also make it less effective over time.
So how do practitioners deal with these challenges?
Well, one way is to use different types of toxins that can help manage the tolerance issue and the antibody problem.
I see.
It's all about finding the right approach for each individual.
Right. Personalized medicine.
Exactly.
Okay, that makes sense.
So it's not just one size fits all.
No, definitely not.
It's got to be tailored.
Okay, let's move on to another big player in aesthetic medicine. Fillers.
Fillers.
I'm super interested in these.
Yeah.
I keep hearing about them everywhere.
It's all the rage.
Yeah.
And for good reason. They're designed to like restore volume. Smooth out wrinkles. Basically, they're trying to turn back the clock on our faces.
I like the sound of that.
Right.
Yeah.
And their history is actually pretty interesting.
Okay.
It dates back to the late 19th century.
Wow.
When doctors first started experimenting with autologous fat transplantation.
So they were already thinking about fillers back then?
Yeah. They were way ahead of their time.
Wow.
But then came a phase of like experimenting with different materials.
Okay.
Paraffin, silicone, collagen.
A lot of trial and error.
Oh, yeah, for sure.
Okay.
But the real game changer came with hyaluronic acid.
Hyaluronic acid.
Yes. That's the one you always see in skincare ads.
Okay.
It's naturally found in our bodies.
Right.
And it's key for keeping our skin hydrated, plump, youthful looking.
So it makes sense that it's in fillers.
It's like the gold standard now.
Okay.
Of course, there are other materials too.
Like what?
You've got CAHO, PLA, dextrin, PMMA, PCL. It's a long list.
Wow, so many options.
But to be a good filler, it needs to meet certain criteria.
Okay, what are those?
Well, first of all, safety.
Makes sense.
Ease of use.
Okay.
And economic viability.
So it's got to be safe,
Yeah.
easy to use, and affordable.
Right. It's a balance.
So break that down for me.
Okay.
What makes a filler safe?
Good question.
I mean, you're injecting it into your face?
Exactly, so it can't cause any harm.
Right.
So a good filler
Yeah.
should be non-pyrogenic.
Non-pyrogenic, what does that mean?
It means it doesn't cause a fever,
Okay.
and it's got to be non-allergenic.
To avoid reaction.
Exactly. We don't want any nasty surprises.
Right.
And importantly, it should be easy to remove.
If you need to.
Exactly. Just in case we need to make adjustments or corrections.
Makes sense. So like a safety net.
Right.
Okay, so that's safety.
Mm-hmm.
What about ease of use?
Okay, so from a practitioner's perspective,
Yeah.
a good filler should give predictable results.
Okay.
Be reproducible so we know what to expect each time, and it shouldn't migrate.
Migrate.
Yeah, like move around once it's been injected.
Oh, I see.
We want it to stay put.
So basically, it needs to behave.
Pretty much.
Stay where it's supposed to.
Yeah.
Okay, so it sounds like a lot of research goes into these fillers.
Oh, absolutely.
To make sure they meet all those criteria.
Tons of research and development.
To get it just right.
Yeah.
Okay, and you were saying we can categorize fillers
so
based on different factors.
There's so many ways to classify them.
Okay, so what are some of the categories?
Well, we can look at the materials used, the duration of their effects, their source, and their physical state.
So material, how long they last, where they come from, and what form they're in.
Exactly.
Okay, let's start with material.
Okay, so we've talked about hyaluronic acid.
Yeah, the gold standard.
Yeah, it's naturally derived. But you've also got fillers made from other natural sources like collagen. And then you've got synthetic polymers.
Synthetic, so man-made.
Yeah, created in a lab.
Okay, so each material has its own pros and cons, I imagine.
Definitely. They all have their own unique property.
Okay, so what about duration? How long do these fillers actually last?
That's a big question for a lot of people.
Yeah, you don't want to be going back every other week.
Exactly. So you've got short-term fillers.
Okay.
Those last about 6 to 12 months.
Okay, so about a year.
Yeah. Then you've got midterm fillers. Those give you results for 2 to 4 years.
Okay, a bit longer.
Yeah. And then there are the long-term fillers.
Those are the heavy hitters.
Yeah. They can last 5 years or even longer.
Wow. So it's like choosing between a touch-up and a more lasting transformation.
Exactly. It depends what you're looking for.
Makes sense.
What kind of commitment you want.
So what about the source of these fillers? Where do they come from?
Well, some are derived from natural sources.
Okay.
Like plants, animals, or even microorganisms.
Wow, microorganisms.
Yeah, it's pretty amazing.
It is.
And then you've got the synthetic fillers.
The lab-created ones?
Yeah, those can be semi-artificial or fully artificial.
Depending on what they're made of.
Exactly.
It's really interesting how diverse the origins of these fillers are.
It is. It's a whole world of materials.
It is. Okay, what about their physical state?
Okay, so fillers can be liquid, semi-solid, or solid.
Okay, so like a range of textures.
Yeah. So liquid fillers, like silicone, they're known for being very flowy, easy to inject.
Yeah.
And then you've got semi-solid fillers, like hyaluronic acid and collagen.
Yeah.
Those are more like gels. Than solid fillers like agar or dextrin.
Okay, those must be interesting to inject.
They are. They're a bit more challenging, but they have their own unique uses.
So it seems like there's a filler for pretty much every need.
Oh, yeah. There's a whole spectrum.
With all these categories and materials, I'm guessing there's a lot of innovation happening.
Oh, absolutely. This field is constantly evolving.
Okay, tell me about it.
So we can talk about fillers in terms of generations.
Generations.
Yeah.
Like technology.
Exactly. So the first generation of fillers,
Okay.
those were introduced between 1980 and 1995.
Okay.
And they were primarily focused on correcting fine lines.
Okay, so more superficial stuff.
Yeah. Then came the second generation.
Okay.
From 1996 onwards. And they expanded into augmentation.
Augmentation, yeah.
Yeah, so adding volume, contouring.
Okay, so a bit more advanced.
Definitely. And then the third generation, that emerged around 2000, and that's all about collagen stimulation.
Collagen stimulation, so they're not just filling in the gaps.
Nope. They're encouraging the skin to produce its own collagen.
Wow, so they're like a jumpstart for your skin.
Exactly. It's a more natural rejuvenation.
That's incredible.
It's pretty amazing what they've been able to do.
Okay, so what's next for fillers?
Well, we're expecting a fourth generation.
Oh, wow.
That's going to focus on minimizing inflammation.
Okay.
So taking an even more sophisticated approach to skin health.
It's like they're getting smarter and smarter.
Right. It's really exciting to see what they come up with next.
It is. It's amazing how far filler technology has come.
It really is.
But with all these advancements, are there still potential problems with fillers?
Well, like any medical procedure,
Yeah.
there are always potential risks.
Okay.
And fillers are no exception.
Right. I mean, you're still injecting something into your body.
Exactly.
So what kind of problems can happen?
Well, some problems come from the material itself,
Okay.
and others are caused by the injection technique.
So it could be the filler or the person injecting it.
Yeah, it could be either.
Okay, that's a little scary.
And some complications might happen right away,
Okay.
while others could develop later.
So immediate or delayed reactions.
Exactly.
Okay, can you give me some examples?
Yeah, so some common immediate reactions are things like swelling, redness, itching at the injection site.
Okay, that makes sense.
You know, your body's reacting to something foreign,
Right,
and there's always a risk of infection.
of course.
And then you could get granuloma formation.
Granuloma formation.
Yeah, those are like small, firm lumps under the skin.
Okay,
And sometimes you can get discoloration or uneven pigmentation.
so your skin tone might change.
Yeah, it can be a bit patchy.
Okay, so those are the immediate ones.
Mm-hmm.
What about the ones that could happen later?
So those can be things like
Okay.
maldistribution of the filler.
Mold distribution, so it's like it moves around.
Yeah, it doesn't stay where it's supposed to.
Oh, that's not good.
And then you can get overcorrection.
Overcorrection.
Yeah, where too much filler is used
Okay.
and it ends up looking unnatural.
So you end up looking kind of fake.
Yeah, or overdone.
Okay, and are there any like serious complications?
Unfortunately, yes.
Okay.
There's a risk of embolism.
Embolism, that's a blood clot, right?
Yeah, and that can be really dangerous.
Yeah.
And in some cases, there's even a risk of blindness.
Blindness
Yeah.
from fillers.
Yeah, it's very rare.
Right.
But it can happen if the filler is injected into a blood vessel.
Wow, that's really scary.
It is, which is why it's so important to find a qualified practitioner.
Right, someone who knows what they're doing.
Exactly. Someone who understands the anatomy
Yeah.
and the risks involved.
And can handle any complication.
Exactly.
Okay, so it sounds like due diligence is key.
Absolutely. Don't just go to anyone.
Right, do your research.
Yeah, find someone you trust.
Okay, that makes sense.
It's your face. You got to be careful.
Okay, let's move on to another technique.
Threads.
Threads, those are pretty cool.
I don't know much about them.
Okay, so basically,
Mhm.
threads are like tiny, invisible scaffolding under your skin.
Scaffolding.
Yeah, they lift and support the tissues.
Okay, I'm picturing tiny little beams holding up your face.
Yeah, kind of like that.
Okay.
And they've come a long way since they were first introduced.
When was that?
Back in the 1990s.
Okay.
They were just basic sutures back then.
Just like stitches.
Yeah, but used for lifting.
Oh, interesting.
And then in 2002,
Hmm.
the first complete barbed thread product was introduced.
Barbed thread, so it like hooks into the skin.
Exactly, and that was a game changer.
Okay.
And since then,
Mm.
we've seen all kinds of materials used.
Like what?
Gold,
Oh, wow.
PDO, PGA, PCL, PLA.
So they're getting more and more sophisticated.
Oh yeah, the technology is constantly improving.
Okay, so what are threads primarily used for?
They have a ton of uses.
Okay, like what?
So they're commonly used for lifting sagging skin.
Okay, that
Okay.
makes sense. Rejuvenating skin texture
Okay.
and even delivering medication?
Delivering medication.
Yeah,
Like-
directly to the target area.
Wow, that's interesting.
They can also be used for augmentation.
Augmentation.
Yeah, like adding volume,
Yep.
contouring,
Mm-hmm.
tissue regeneration,
Okay.
and even scaffolding for reconstruction.
Wow, that's a lot.
It's a very versatile technique.
It is. So how do they work for lifting?
Okay, so imagine them as tiny suspenders under your skin,
Okay.
holding the tissues up
Mm-hmm.
and counteracting gravity.
So they're like an internal bra for your face.
Yeah, kind of.
Okay, that's a good analogy.
And as they settle in,
Yeah.
they stimulate collagen production.
Oh, so they have a double effect.
Exactly.
Mm.
Immediate lift and long-term rejuvenation.
That's awesome.
It's a win-win.
It is. Okay. And you said there are different types of threads?
Yeah, there are a few.
Okay, what are they?
You've got normal threads,
Okay.
tornado threads.
Tornado threads.
Yeah, they have a spiral shape,
A
screw
screw.
threads.
Like a screw.
Yeah, they have a threaded design and cogged threads.
Cogged, like gears.
Yeah, they have little barbs that grip the skin.
Okay, so each type has its own specific purpose.
Exactly. We can choose the best one for each patient.
It's like a whole toolkit for facial rejuvenation.
It is. It's pretty amazing.
Okay, let's shift gears a bit
Okay.
and talk about fat reduction.
Fat reduction, another hot topic.
It is. There are so many non-surgical options now.
Oh, yeah. The demand has exploded in recent years.
Makes sense. Nobody wants surgery.
Right. It's all about being less invasive.
Okay, so Give me a rundown of some of these techniques.
Okay, so one of the older techniques is called mesotherapy.
Mesotherapy, okay.
And it involves injecting a cocktail of substances.
A cocktail?
Yeah, like a mix directly into the fat layer.
Okay.
And this cocktail usually includes things like vitamins, minerals, amino acids, enzymes.
So it's like a targeted attack on fat cells.
Yeah, kind of. It's meant to break down fat cells and improve circulation.
Okay, interesting.
Another approach is called hypotonic lipolysis.
Hypotonic lipolysis.
Yeah, or HPL for short.
Okay.
And this one involves injecting a hypotonic solution.
Hypotonic, so it has less salt.
Exactly. Less salt than the body cells.
Okay.
And this creates an osmotic gradient.
Oh, so it draws water into the fat cells.
You got it.
Okay.
And that causes them to swell and eventually burst.
So it's like they're being flooded.
Yeah, kinda.
Until they explode.
It's a bit dramatic.
It is. Okay, so we've got mesotherapy and HPL. What are some of the other agents?
Well, there's phosphatidylcholine.
Phosphatidylcholine.
Or PPC.
Okay.
It was really popular in Brazil.
Okay.
But it got an FDA warning in 2010.
Oh, why?
Concerns about safety and effectiveness?
Oh, so it's not really used anymore?
Not so much, no.
Okay, what else?
There's lymphatic drainage.
Oh.
Or LLD.
LLD, okay.
It helps with fat reduction by promoting the removal of fluids and toxins.
Oh, so it's like a detox for your body.
Yeah.
Kind of. Okay, that makes sense.
And then there's Kybella.
Kybella, I've heard of that one.
Yeah, it's pretty new.
Okay.
And it's the first and only FDA-approved injectable for reducing submental fat.
Submental fat.
The double chin.
Oh, okay.
Yeah, it uses deoxycholic acid.
Deoxycholic acid.
Yeah, it's a naturally occurring molecule that helps break down fat.
So it's like a targeted fat melter.
Exactly. Just for the chin area.
That's pretty cool.
It is. It's a game changer for a lot of people.
I bet.
So yeah, Kybella is pretty exciting.
Okay, so
And then there's Kybella.
So we're talking about Kybella, right?
Yeah, and all these different ways to reduce fat without surgery.
It's pretty incredible how many options there are now.
It is, and the technology just keeps getting better.
But with all these advancements, I do wonder about, like, the ethical implications.
Oh yeah, that's a really important point to consider.
Right, because, like, as these procedures become more accessible, less invasive, there's a chance they could become, I don't know, almost too commercialized.
I see what you mean.
Like putting pressure on people to conform to certain beauty standards.
Exactly, and we already see that happening with social media and filters.
Yeah, totally.
Right, like these unrealistic beauty standards are everywhere.
Yeah, it's hard to escape.
And as aesthetic medicine becomes more mainstream, we need to be really careful about that trend.
Right, and make sure people are making informed decisions.
Exactly.
Not just feeling pressured to do something.
It's about what you want, not what society tells you to want.
Right, it's so important to remember that.
It is, because it's a slippery slope.
Like what starts as wanting to enhance your features could turn into like chasing an unattainable ideal.
That's exactly what we want to avoid.
Yeah, because that chase can be harmful.
Absolutely. Mentally and physically.
Right. It's important to remember that true beauty comes from embracing your individuality.
Not trying to fit some mold.
Not conforming to some arbitrary standard.
That's what makes you unique.
That's what makes you beautiful.
Yeah. Well said.
Okay, so that's one ethical concern. Another one that comes to mind for me is inequality.
Oh, yeah. Good point.
Like aesthetic medicine can be expensive.
It can.
And not everyone has access to it.
That's true.
So if these procedures become more and more mainstream, we need to figure out how to make sure there's equitable access.
Absolutely.
Right. It shouldn't just be a privilege for the wealthy.
It's a healthcare issue.
It is.
And we need to have these conversations about the societal impact and make sure these advancements are used responsibly.
Okay. And speaking of responsibility, informed consent is crucial. Right.
So crucial.
Like patients need to understand the risks and benefits.
Absolutely.
Before they get any kind of procedure.
It's non-negotiable.
And informed consent is more than just signing a form, right?
It's way more than that.
It's like a real conversation.
It's a dialogue.
Between the practitioner and the patient.
Yeah.
Where they have all the information.
All the information they need.
To make a truly informed decision.
Not just feel pressured.
So you're discussing potential risks.
Absolutely.
Realistic expectations.
Yeah.
Alternative options.
We'll talk about everything.
So it's like a partnership.
It is a collaboration.
Between the doctor and the patient.
Yeah. We're both invested in a positive outcome.
Okay. And a positive outcome isn't just about the aesthetic result, right?
It's about so much more.
It's about the patient's safety,
Absolutely.
their well-being,
Mm-hmm.
their overall satisfaction with the experience.
We want them to feel good about the whole process.
Right. And speaking of satisfaction,
Yeah.
setting realistic expectations is so important.
Couldn't agree more.
Right. It's not about magically transforming into someone else.
No magic wands here.
It's about subtly enhancing what's already there.
Working with what you've got.
Working with nature, not against it.
That's the key.
Right. We can enhance our features,
Absolutely.
but we can't stop the natural aging process.
Nobody's found the fountain of youth yet.
And it's important for patients to understand that.
We're not trying to make you look 20 again.
It's about aging gracefully,
Yeah.
not fighting a losing battle against time.
It's a journey, not a race.
Okay, so everyone adhering to this one narrow standard of beauty.
That would be a disaster.
It would.
Everyone would look the same.
It's more about enhancing individual features,
Yeah.
bringing out the unique beauty that already exists,
That's the goal.
helping people feel confident and comfortable in their own skin.
No matter what that looks like.
I love that it's not just about changing appearances.
Nope.
It's about empowering people
Yeah.
to feel good about themselves.
Exactly. That's what it's all about.
And that ties back to Maslow's hierarchy of needs.
Oh, yeah. Full circle.
Right, like aesthetic medicine,
Mm-hmm.
when done responsibly and
Oh,
ethically,
that's key.
can contribute to self-esteem,
Absolutely.
even self-actualization,
It's about becoming the best version of yourself.
inside and out.
I like that. A holistic approach to
Yeah,
beauty
right.
and well-being.
Okay, so we've talked about the ethics,
Mm-hmm.
the philosophy of aesthetic medicine.
The big question.
Yeah, but what about the practical side?
Okay.
What advice would you give someone who's considering these procedures?
Well, first and foremost, do your research.
Yeah, that's always good advice.
Find a qualified and experienced practitioner,
Okay.
someone you trust, someone you feel comfortable with.
Yeah, that's so important.
Look for someone who prioritizes patient education,
Mm-hmm.
safety, natural-looking results.
Okay, so it's not just about finding the cheapest option.
No, you got to invest in your health.
Right, it's your face, your body.
You want someone who knows what they're doing.
Exactly.
And also, be realistic about your expectations.
Okay.
These procedures can enhance your features,
Yeah.
but they can't make you look like someone else.
Right, no magical transformations.
And they can't stop the aging process.
It's about aging gracefully.
Yeah, working with what you've got.
And remember, beauty comes in all shapes and sizes.
There's no one ideal.
No one standard.
It's about celebrating what makes you unique.
Absolutely.
And lastly, take your time. Don't rush into anything.
Yeah, weigh your options.
Think it through.
Make a decision that feels right for you.
It's your body, your choice.
That's great advice.
And remember, aesthetic medicine is always evolving.
Really, it's constantly changing.
New techniques, new technologies.
It's exciting.
It is, so stay informed.
Keep learning.
Keep up with the latest developments.
Okay, before we move on,
Yeah.
I just want to take a moment to thank London Heartbeats Z Academy again
They're amazing.
for their support in making this deep dive possible.
Couldn't have done it without them.
If you're interested in learning more about healthcare, check out their website.
Over 140 courses.
It's incredible. And follow them on social media.
Facebook, Instagram, Spotify, YouTube.
They're a great resource.
They are.
Okay, so before we wrap up,
Mm-hmm.
I'm curious about one more thing.
Okay, what is it?
We've talked about the psychological impact of these procedures,
Yeah.
especially in relation to body dysmorphic disorder.
Mm-hmm.
But even for people without BDD, there's a potential for these procedures to become addictive.
That's a real concern.
Right. Like, how do you address that as a practitioner?
It's something we're very aware of,
Yeah.
and we talk about it openly with our patients.
So it's about recognizing that potential for addiction
Absolutely.
and addressing it proactively.
We want to help people feel good about themselves.
Yeah.
But not at the expense of their mental health.
Right. It's got to be a healthy balance.
Exactly. It's about helping them achieve their goals,
Mm-hmm.
but also maintaining a realistic perspective
Okay.
and a healthy sense of self.
So it's like finding that sweet spot.
Yeah, the balance between self-improvement and self-acceptance.
I like that.
That's the key.
Because ultimately, we want aesthetic medicine to be a positive force in people's lives.
Not something that takes over.
Okay. I think it's time to wrap up this part of our discussion.
Yeah.
Any final thoughts before we move on?
Well, just to reiterate,
Mm-hmm.
aesthetic medicine is a constantly evolving field.